glad you're here. I'm Andy Reynolds with NCQA. On behalf of everyone at our company, welcome to our Health Equity Forum. We appreciate that so many people have come from 30 states across the country to focus for 2 days on learning and drilling into vital topics, the intersection of health care improvement, quality improvement, and health equity. This forum is NCQA's first multi-day conference that's concentrating on the connection between quality improvement and health equity. We didn't quite know what to expect, and we're so encouraged to find so many people who care about better, more equitable care. So many people have traveled to focus on these vital topics for 2 days. I'd like to introduce someone who made it possible for us all to be here. She founded NCQA in 1990 as a 3-person operation working out of borrowed office space. Today, NCQA is almost 500 people who, along with many people like you, are focused on building better, more equitable care for people and communities across the country. Please help me welcome NCQA founder and president, Peggy O'Kane.
Thank you, Andy. And thank you all for being here. We're very excited to have you here, and our team has put together a wonderful program, and I know many of you are participating. So when we started NCQA 34 years ago, we could only dream of a gathering like this. So many people who work to improve healthcare together in one place. And I always think we're here, quality is hard work, and I'll talk more about that later. But we're here to learn from each other and to really encourage and inspire each other. So don't be shy, fly your flag high, and let people know about the good stuff you're learning. We're in a new field, and we really need to share ideas. So I'd like to frame for you the priorities that motivated us to host this event. And I'll explain why California is the natural place to meet. And I'll tell you what I hope you'll get from our time together over the next 2 days. It's fair to say that NCQA is obsessed with making healthcare better and more equitable. So we always say there can be no quality without equity. When I began my quality career, we saw quality and equity as separate. In fact, equity was kind of off in a corner, I would say. You'd work on one topic for a while, then maybe you'd get around to work on the other. That means that the greatest opportunities for improvement often are in marginalized communities with people who are not getting enough attention. And the road to the greatest quality gains runs through health equity. So I think that's a very powerful construct. When we started measuring quality 34 years ago, we were shocked at how bad the results were. I feel that same shock now, seeing how much worse health outcomes can be for underprivileged racial and ethnic groups. So we're proud that we've led the charge to get every care organization to look at itself and embrace quality measurement all those years ago. And we're proud that we're doing the same thing now with health equity. We've committed to integrating health equity into all of our measures and programs, and you'll be hearing a lot about that while you're here. And we've made health equity the thread that unites every quality priority. You know, I think you know, if you're in a plan, you certainly do, that digital quality measurement is one area where goals for better care and goals for more equitable care actually converge. With digital measurement, we're building a world where data you generate as you deliver care flows directly into quality measures. Then, when you're delivering care, you're presented with information that enables you to do the right thing right there, not a year later. Digital also helps you move beyond a formulaic approach to quality to one that can be personalized. Personalization includes both pre-existing conditions or co-occurring conditions, and accounting for the race, ethnicity, and personal circumstances of each patient. That's why we want to collect comprehensive demographic information, including data on race, ethnicity, sexual orientation, and gender identity. Behavioral health is another priority for us. It's another area where our goals for quality and goals for equity need to be aligned. People living with challenging personal circumstances, including poverty, have higher rates of behavioral health conditions. They can have a hard time functioning in the world, so they have higher levels of social need and stress. And having a behavioral health condition causes many other practical difficulties for the person in areas like unemployment and housing. It's our responsibility to think about how these things interact and then build solutions that reflect both parts of that intersection. I said this is the perfect place to have this meeting because California has been a leader in making health equity a priority. This is a state that sets the standard for others to emulate. Led by State Secretary of Health Dan Galey, California has united agencies under a shared mission of achieving health equity. As an accreditor that upholds standardized quality requirements, we draw our strength from leaders who mandate our programs. We've been proud to collaborate with California. And 12 other states have followed California's lead by mandating NCQA health equity accreditation for their Medicaid managed care plans. By pointing to California's coordinated leadership and steady commitment to health equity, we can shine a light and bring better care to communities in need everywhere. So let me tell you what we have planned for this conference. Day one orients us to the big picture and provides context for action. Today's discussions will ground you in the grand vision of equitable health care and equip you with the perspective to turn ambition into results. You'll see diverse approaches to this shared mission through the eyes of California leaders working at different levels of the system. Our panels will reveal a vibrant truth. Equity isn't achieved by isolated efforts. It demands synchronized collaboration. By engaging with thought leaders across the healthcare spectrum, you'll gain insight into our collective role in this journey. Seeing the big picture will help you prepare you to contribute to this work in your community. Day two is about action, building your health equity toolkit so you can put your principles into practice. We'll highlight the successes and challenges others have faced, helping you navigate your own path. An interactive workshop about NCQA's Health Equity Accreditation and Health Equity Plus programs will illuminate steps you can take to advance health equity. You'll come away with tools and resources to help you translate knowledge into action. We're fortunate to have diverse perspectives, commercial plans, public health officials, and more represented on our panels. That variety reflects our understanding that equity requires a multifaceted approach, a collective effort where we all have a role to play. I want to just make sure you know we don't have all the answers. We just know we're not making progress fast enough. The inequities we face in healthcare start outside the healthcare system with problems such as poverty and lack of housing. Low-income people don't have a lot of room for things to go wrong. If you're a low-wage hourly worker and you have to take several buses to get to the doctor, you don't have the same access to care, even if the system isn't treating you poorly. So we need to keep these complexities in mind. Effective engagement requires tailoring the message to each community's unique perspective. How you approach the conversation in a community is just as important as what you say. Remember what you learned in Public Health 101. Meet people where they are. Health equity happens to be the label NCQA applies to building a better healthcare system that works for everyone. You may need to use another term for the same ideas to be accepted where you work. Regardless of what you call it, we can set an intention to deliver meaningful whole person care. Mainly, I urge you not to think in terms of faceless crowds when you think of population health. When you think about population health, think about all the people that are in that population and the individual faces. Can you see the whole person and everything they are? Can you see the individual and not just the next visit or the next insurance claim? Ultimately, addressing social needs and risk factors forms the foundation of quality health care for everyone, ensuring we reach every patient wherever they call home. That brings me to you and what I hope you'll take away from this forum. We convened this conference so you can learn from outstanding speakers, inspire each other, and support each other. That's important because if you work to make healthcare better and more equitable, your job is hard. Quality is hard. Reinventing healthcare is hard. Dismantling decades of unfairness and inequity is one of the hardest and most important jobs in healthcare today. But we've done hard before. Hard was when everyone assumed quality was fantastic and we had the best healthcare system in the world. Nobody could understand why we wanted to measure it. We had to convince people measurement was worthwhile. And what a shock when they saw the numbers. Hard is what healthcare workers in the trenches face every day. We want to use digital systems to reduce measurement burden and make their jobs easier and make their lives better. So we've done hard things before. We did it together, and that's how we'll accomplish our mission now. The transformations we seek in quality and health equity are bigger than any one person or organization. And so we'll work with new partners, we'll build new skills. We won't cling to the past, but we will learn from it. We'll take the good things that we've been doing and carry those forward. And then we'll do the new things that we have to do. That's what we're here to do, and I thank you for being part of it.